he, he completed his foundation training from the West Suffolk Hospital. He was the clinical research fellow in thoracic surgery for the year 22 to 23. Mr. Ali is interested in trauma and orthopedics and is a current applicant for the ST3 training post. Thank you everyone for joining us. We will start off the discussion by hearing about your journeys and what factors did you consider while making the decision of pursuing a surgical training in UK. So Dr. Abshar, we can start with you.
Thank you so much, Shivaria, and thank you for inviting me to this talk. So I'll just get right into it. My journey has been a bit twisted in the UK because, as we all understand, AQM, at least the culture is to be more US oriented. So that's what I wanted to do as well. I gave my step to CS, but I was unable to pass it. And then I ran into some financial difficulties. So I was trying to make like a pragmatic decision on what I need to do and how I need to pay off, even if I'm paying for USMLEs. So I thought the first thing I need to do is to do my house job that would secure my future in Pakistan, where I was at that moment. So I did the house job, and then one thing led to another, and then house job opens up pathways within Pakistan and also UK. UK PLAB exam is also cheaper than, like, the whole process is cheaper than USMLE. So I just wanted to secure my future at that point. So I just aimed for PLAB and sort of like going with the flow of the moment. Ended up, pursuing the pathway aggressively, and now I'm here as a senior house officer, pretty satisfied with my job. Yeah, that's about it. If you have any questions, I'd be happy to answer them.
Thank you, Dr. Abshar. At this point, can you also describe what a senior house officer is and your responsibilities in this job?
A senior house officer, so the grades are pretty similar to the grades in Pakistan, the local system of Pakistan. We don't have internships here. Senior house, so we have foundation programs, that is foundation year 1, which is equivalent to house job in Pakistan, and then foundation year 2. And after that, you get into core training, which is what Ali has completed as well. Sorry, Ali is in the part of as well. Senior house officer is the equivalent of FY2, but they're not in a training program yet. So they have the same amount of responsibilities, but they're locally employed doctors, as they like to describe it. In terms of responsibilities, do you want me to?
Sure, you can go on about that.
Yeah, so it's just a house officer, but a bit more senior. So you have a bit more responsibility in that sense, like, dealing with ill patients and all, they'll all come to you and stuff like that. Yeah.
Thank you, Dr. Ashram. We would now move on to Dr. Amala.
Hello, Assalamu alaikum. So for me, it was kind of clear from the start that I have to go to UK. I was preparing for it since my 3rd year, but finally I couldn't do the electives for some reason. And then as I moved on, I got late because of the COVID thing, because COVID ki wajah se, all the exams were being cancelled and all that stuff. But yeah, and now I am working as an FY2. But again, I am like working like Absha. It's not a training job, but it's like a locally. They have like hired me locally, but I'll be getting my competencies and everything signed. So that's pretty much it.
Thank you, Dr. Amala. We will now move on to Mr. Ali.
Hello, Assalamu alaikum. So I pretty much decided when I was in, I think 3rd, 4th year probably, to decide to move to the UK because I wanted to do orthopedics. So that's something I'm set on. And looking at, again, financial things in terms of elective costs, costs of applications, USMLE, overall costs, it just made more financial sense to come to the UK for me. I'm also a British citizen anyway, so I don't have visa issues in that way, so it's a lot easier for me. And I have family here as well, so those are kind of things which push me in the direction of the UK rather than the US. In terms of what I've done so far, I applied through the foundation program, so I was in a training post in F1, F2. After that, I've done basically non-training jobs in orthopedics for 2 years, and then I did about 6 months in thoracic surgery as a registrar. And right now I'm working as a locum doctor, basically, but I'm not in a training post. I've done the equivalence of core surgical training, got that signed off while doing the non-training jobs. So that's something as well. I'm going to elaborate on that later. Afshan basically went through the responsibilities of a house officer pretty well. It's basically like an intern for another year with a little bit more responsibility.
Right. So now we could move on to discuss more about the specifics of the pathway to getting a training or a non-training job in the UK. And Mr. Ali has shared some relevant resources with us, which we have already forwarded to our participants, and I would encourage you all to go through those. So Mr. Ali, can you briefly describe this pathway for us?
Yeah, so basically, if you're in the position I was in, then I think for foundation year one, applying to the foundation program in the training position, they don't sponsor visas, unfortunately. I think that's kind of like the main blocking part for most people to applying into foundation year one. But if you're applying to foundation year two, I think, or if you're applying to a non-training SHO job, if you've done your internship, you can easily apply into that and come to the UK after you've done your lab and your GMC registration and all those things. I don't know exactly how long that takes now, because I did it a while back before COVID. So obviously there's the time obviously more extended, I would believe now, in getting that sorted. Other than that, after that, you can apply to, if you've done your foundation competencies, you can apply for a core surgical training post. To do that, you basically need to meet certain kind of checklist criteria to get points to be able to interview and then interview. I think this year they've added a exam to that as well to assess who's eligible for an interview, which is a kind of a medical exam and a ethical judgment exam mixed in a way. It's called SJT. The name for the exam is the MSRA, so it's multi-specialty recruitment assessment, something like that. It's all in the documents and things I've sent across in more detail, and it's available on the websites as well. If you look at Health Education England, things like that. So you'll be able to find a lot more detail on that. And once you do your core surgical training, which is usually 2 years, and you rotate through various surgical specialties, during that, you do your competencies. Even if you're not in a training post, you can kind of work SHO or house officer jobs, or junior clinical fellow jobs, where you can get all these competencies signed off, as long as you know somebody who's willing to sign them off for you. Obviously better to do it through a training program, I would say. And once you do your MRCS exam, which is kind of your first part to say you're competent to enter into specialty training, then you can apply for specialty training. And then it's again a similar process to applying into core surgical training. There's a whole checklist of things, and you have to go through, get points on those things in terms of procedures, audits, research, presentations, things like that. And again, an interview, and then you get into higher specialty training. Do you want me to kind of elaborate on where that leads to up to the consultant part, or are you happy with that?
We could go on to the consultant
Okay,
part.
so basically, yeah. So core surgical training is 2 years. Specialty training, for some certain specialties, they have run-through trainings that rather than doing core surgical training, you go straight into specialty training. Those are a bit more competitive. So it's like ophthalmology, neurosurgery, cardiothoracic surgery. So these are all more in terms of specific in terms of that. And then you can get it once you do this. If you do either run-through training or higher specialty training, that's about 6 years again in the specialty. And you do about once you coming to the end of that, you do an FRCS exam, so which is your completion exam, and then you would CCT, which is basically completion certificate of training. And then after that, either you become a consultant or you do your fellowship and then go on to become a consultant after that.
Right, thank you. So we will move on to Dr. Afsha. Dr. Afsha, you can share the presentation too.
Sure, let me just share the screen. So this presentation has already been posted on Softword. You can search it through Pathway to UK. That's the title of the presentation. And I gave it a while back, so some of the things have changed over time, but I will be covering the basic pathway that it takes, the pathway that you can take for, moving to UK. So you currently are in med school, you'll graduate. So the thing about UK is that you can plan for it even after graduation. You don't have to sort of panic about it right now. You can just relax and consider it as one of the options that you want to explore in the future. So the first thing that you're going to do is that you're going to give your IELTS, preferably while you're doing your house job. You can also give your PLAB 1. The issue is that we're not getting PLAB 1 dates nowadays. There's a huge backlog because of COVID, and they're just trying to still keep up with the backlog. So people have to wait at least like a year or something to give their exam. So maybe, planning would be helpful at this point, that, if you apply for it right now, maybe you'll get, a date 2 years down the line or something like that. After you're done with your PLAB 1, which is a written exam, which they're going to change to UKMLA this year, from what I understand, as well. You're going to be moving on to PLAB 2, which is more of an OSCE session. It's not very difficult. It's exactly like the final year OSCE, nothing too new. And I think as AQ grads, we're pretty equipped to handle all kinds of OSCEs. So for PLAB 2, you have to come to the UK, and the main center is in Manchester. And usually it's advised that while you're here, try to get an observership with in any hospital, in any specialty that you want. This sort of just adds to your CV. It's not a necessity, but it definitely helps to have an observation as practical experience of having worked in the NHS and have understood the system, because it's quite different from the systems that we're used to, which is private healthcare in Pakistan, or in the US when we go for electives. It's a very different system as well. Once you have passed your PLAB 2, you can apply for the GMC registration. And once you have the GMC registration, then you can apply for jobs. So that's the basic. So this is what the training structure looks like. And I think Ali covered parts of it as well. So you have med school, and then you have foundation year 1 and 2, which is equivalent to house job of 2 years in Pakistan. After that, you have core training and specialty training. Now, this is in surgery, these are the most common ones. So I want to do pediatric surgery. So what I'm looking at is 2 years of core training in general surgery with any specialty that I'd like, and then a specialist training surgery for the next 3 to 8 years, and then en route to consultancy, having given the exams that Ali mentioned. The second pathway is a GP pathway. This is equivalent to the family medicine doctors that we have here. But in NHS, there's a heavy reliance on the primary care system. So GPs are actually one of the high-paid specialties, and they're also really in demand. Again, there are pros and cons of going to any career pathway that you want to. So, and that's also the shortest pathway. So it just takes like 3 years for you to become a consultant. And then you have a run-through training. What this means is that there's some specialties that they don't require core training and then specialist training for. They just put you into a program, and then you just end up becoming a consultant after 1 to 8 years in that particular specialty. So the important thing to notice is that there are multiple pathways of entering the UK training system. So there is the training pathway, which is all of this, which is foundation year 1, core trainings, specialty training, and then consultancy. But along with that, they also have sideline pathways, which are not training pathways, but you're employed by local hospitals as helping hands. Like, is that how I would like to describe it? So for example, I am an SHO, and that's the equivalent of FY2. You can be a core trainee, you can be an equivalent of core trainee as a specialty doctor as well. You're paid a little bit less than the trainees. You have work a little more hours than the trainees. But considering the overall lifestyle, it's pretty similar. You can attend the same training sessions at the end of your training, at the end of your, like at the end of my FY1, which is the SHO year, I can get my competency signed off, and it will be the same thing as somebody having gone through the training post. So that's pretty convenient in the sense that, especially as an IMG, there can be multiple entry points, which makes it a little more welcoming in that sense. And the most common positions for applying is the FY2 positions after giving the PLAB exams. These are the, again, locally employed doctor positions that both Amala and I have are currently in. So F5 postings are very rare, but it's not to say that they don't exist. They do exist, which means that instead of doing your house job in Pakistan, you do your house job in the UK. The reason why they're rare are because UK graduates, when they graduate, they're going to be doing their FY1 regardless. So that leaves lesser spots for IMGs. But what happens with FY2 posts is that they kind of take their gap years, or they just, like transition into doing other things or taking a break or whatever it is, or maybe, quitting medicine overall. So that leaves some posts for FY2 as well. We can talk about some tips to prepare for the UK pathway during medical school. And one of them is, kind of planning your PLAB exam, because the UK MLA exam, because of the space issue. So I think that would be something that I would add to this presentation as opposed to previously. Audits are something that you guys can do. Audits are sort of like quality improvement programs. You can just go up to any person who's doing research in AKU, just ask them if they want to do an audit. Audits are basically, like the image says here, you identify an issue that you feel like is going on in a particular department. For example, if you're working in surgery and you feel like the post-op care isn't adequate, you point out what's happening, why is it happening. You see how the current practice is being deviated from the standard recommended practices. You collect your data to quantify that information. You compare it with standards, implement change, and then see, if your change has worked or not. So this is a quality improvement, and NHS values audits more than they value research. It is something that is they prioritize over research. So because research is, like I've written, is not super important, but it helps to have the relevant experience for sure. And I think as AQ grads, by the time you graduate, you definitely have some sort of experience, which is more than enough. And again, electives and observerships are not super important, but it always helps. So when you're giving your IELTS exam, this is in consideration to when you also plan to give your UK MLA. So it's only valid for 2 years, so kind of plan accordingly. The duration of an exam is 2 hours, 45 minutes. OAT exam can also be given instead of IELTS. I think Amala gave OAT, so she can guide you on that further. Okay, so one of the decisions that I had to make was house job in AQH versus house job outside AQ. I ended up doing house job outside AQ because I ended up not applying in house job within AQ at all. So the pros of doing house job in AQ are that it's excellent training. It can be incredibly hectic, but you are being trained on the precise guidelines, and you're essentially becoming a more, coherent doctor, is how I'd like to describe it. The systems are electronic, more or less, so that kind of helps you, because it's the mix of paper trail and working in an electronic system, so that gives you a good view of what it would be like in NHS as well. Apparently it pays the most competitive salary fresh undergraduates can get. It's another thing if the the overall salary is just below the bare minimum, but yeah, that's what it is. House job outside AQ, they're very relaxed, a bit too relaxed, in the sense that you have the space to work as hard as you want to, or also just kind of like have your limits and focus on other things maybe. For me personally, I was doing an unpaid house job, and a paid house job is also really challenging to get on its own, but I also had to financially support myself, so I had to do like multiple jobs at the same time. And that didn't give me a very good house job experience, but it did give me a certificate. So I'm okay. I'm at peace with that. And it's good for getting an experience in Pakistani healthcare systems, which is honestly falling apart at it seems. So you really learn to work in a system which is very low on resources, very low on human time, energies, and even patience. But it's worth the experience for sure. And house jobs in Pakistan, they don't have a proper training structure. It's very self-driven. So that's one of the cons as well. So for PLAB 1, a prep time is around 3 to 4 months. You use a question bank Plabbable, which is the basic question bank. It is, I think it becomes very easy, especially once you've given your final year exams, to do Plabbable. So I would recommend that kind of manage in such a way that you're doing Plabbable question bank after your exam because you're already studying for the final year OSCE and exams. And the clinical knowledge is from third and final year profs. The result comes in approximately 1 month. PLAB 2 is an OSCE type, training period. So you generally join an academy, which is for around 14 days. These academies help train you in the NHS system. They give you these little tidbits of what's different in NHS system and how to operate on it because NHS system is very patient oriented. You have to be incredibly nice to patients. It's almost a requirement. So that's what they teach you. And honestly, trust me, we're not used to that in Pakistan at all. People are walking around with, all sorts of God complexes and they don't really treat the patients the way they want to be treated. So you really need to learn that and incorporate that into your daily dealings. And the academies actually teach you that along with obviously the necessary knowledge. Total prep time is 1 to 2 months and the result is expected in 2 to 4 weeks as well. These are some of the famous academies: Common Station, Samson, Swami, Aspire, all run by IMGs who have themselves moved to the UK. Okay, so I'm just going to skim through this. This presentation is available on Softboard, so you can always go through it. This is an approximate of cost, and this is widely changed because now the exchange rate is through the roof, so it doesn't apply anymore. The challenges that we had in 2021, which still stand very much so, is that exam seats for both PLAB 1 and PLAB 2 are not available. People have been waiting for like a year, 2 years, 3 years for just getting the seat. When you travel to the UK, that's all an additional cost. And Brexit may pose unforeseen challenges, but we're kind of like going through that and it's okay. So I'd remove this as well. So yeah, this is it from my presentation. I am happy to answer that you guys have.
Thank you so much, Dr. Afshan. That was very comprehensive. So I will move on to Dr. Amala. Dr. Amala, can you share on your experience during medical school, how you built your portfolio to apply for a job in UK? And can you also point on your decision to take OET exam?
Yeah, actually, I'll just start with everything. So basically, after my graduation, I was hoping to get into UK, but I was planning to give my exams throughout my house job and then I'll just move here. But the thing for me was that I unfortunately was not able to get a PLAB OET or PLAB anything because during my internship because I didn't had anything. There was no dates because of the COVID. और ये था कि for me AQ was the best choice. Reason being कि I was like I could just join and I didn't had any gap in my CV because of that. So after doing that, OET I think was a little bit better for me, especially because OET is very based on your clinical, it's kind of your clinical exam. So your English, your everything that is like based or tested on according to your medical knowledge. The letter that you have to write is either a referral letter or a discharge letter. Then similarly, like everything is based on your medical knowledge. So I think that was pretty much easier. I'm not sure how it's nowadays because I have heard it's kind of different now. Second thing about that was when I got my PLAB date, as everyone mentioned, it was so delayed. So I got my PLAB dates, I think around 1.5 years after I cleared my OET. So there was a lot of gap in between that. So I joined in as a research associate. So research associate was basically just for that was my choice shuru se because research helps you in getting job. Like this is what we heard, ke research will help you to get into the system and everything. So I did my research. I also joined as a teaching associate for third year medical students. So these were all I think I've almost explained everything for PLAB 1 and PLAB 2. But one thing that I would like to highlight was कि Plat 2 ke liye, whenever you are coming and if you have time, I would suggest to get some observership, yeah, electives, whatever it is, especially in small towns. If you get it in a small town and you know someone there, like in the hospital, or you even if you don't know them, just make a a repo kind of with them. That way you get jobs very easily. So I had to wait, I think, around 4 to 5 months to get this job. I think Afshan also waited a little bit, at least for 4 to 5 months. And the hospital that I'm currently working in, I know a lot of people who just did their observership and got like their job the next month as soon as they got their GMC. So I think that was something that I didn't know and I should have worked on. Moreover, I think once you get into the system, then you get hold of it and then you can do everything. Audits are also very important. I think research didn't help me at all. If I had done any audit, maybe that would have taken me to another row. So that's pretty much it. I think if there's any question, then I can explain more.
Thank you, Dr. Amala. We would move on to Mr. Ali. Mr. Ali, can you point out what can be done during the foundation years to build your portfolio for applying to a CT or an ST job?
Yeah, thanks. So basically, I think if you're moving from Pakistan, especially if you do a house job at AQ, you'll be pretty well prepared for working in the NHS. No matter where you work, observerships might help, but they don't mind if you don't do any electives or observership in the UK before joining, to be honest. Otherwise, if you're in foundation years, I think after like spending maybe a few weeks to a month settling down, the best thing to do is kind of start getting into doing audit projects. That's the most important thing. When you do an audit project, you want to do it in terms of a cycle. So you do one cycle where you look at the standards, you compare them, see what the deficiencies are, make an intervention, and then re-audit to see whether your intervention has actually had any effects. So this is the most important part. So that's like a whole quality improvement cycle then. And if you're looking at other things, then that itself kind of leads on to doing more things. You do an audit project, you get your results, you present it at a local meeting, then you take that same thing, you can present it at a national or international meeting, wherever it's relevant, and that gives you more points as well. If you're in a surgical rotation, I think if you're surgical rotation at the end of F1 or F2 and you want to give your MRCS part 1 and you feel you can, that's a good time to do it. I give it at that time. And it's very achievable. It's not a very difficult exam. It's kind of similar knowledge to what you'll do in medical school at AQU, and then just applying your clinical practice, which you learn while working. And then other than the exams, once you do audits, like the way I do it is I do an audit, I present it internationally, nationally. I use the same audit to write a research paper and get that published as well. So it's all the same project, get the maximum out of it. So use the same project to get the maximum out of things. Don't waste your time. When you're doing audit projects, select things which are simple, easy to do quickly. You don't want things which will take a year collecting data. That's just a waste of your time. A lot of consultants will sometimes just give you something that they're interested in looking at, but it's not necessarily useful for you. And it's not really an audit project. They might just be like, oh, can you look at how many patients had surgical site infections or something for my patients? And that's not really an audit project, and it's not beneficial for you either. So just be careful in terms of what you're working in. Other than that, getting operative experience is variable, depends on how your rota is kind of planned. Wherever I've worked, they've treated training doctors, non-training doctors equally in terms of pay and rota structure, everything. So we all got the same training opportunities. That's really how it should be. If you're not being treated equally, it's really not fair. It's really not right. So that's something you should always be careful before accepting a job, that are they going to offer you the training opportunities to get into theatre? So if you're not going to get that chance and you're just going to be a ward monkey, then there's no point doing those things. So just be careful when you're doing that. In terms of other things, attending conferences, so surgical conferences, doing teaching sessions. So, and it doesn't have to be like formally organized teaching sessions. It could be things like you sit down with a few medical students, just teach them about something for half an hour, maybe teach them about how to give IV fluids for half an hour, and then get some feedback. So whatever you do, get feedback, get hard copies of evidence that you've done things. Even in medical school, if you're in societies, get letters, evidence that you're in society. If you're doing operations in medical school and you're helping out with operations medical school, fantastic. Get that in a logbook, get that written down in a letter. If those consultants you're doing with at AQ are also registered on the GMC register, then make sure you get those on a proper logbook with a GMC number as well. So these are all things which will count, even in medical school. So you can work towards these things as well. I think audits is probably the most important thing. If you start working on audit projects earlier in medical school, that's fantastic. So that's usually the thing people get stuck on, because coming as an IMG, people aren't sure exactly what an audit project is. And then they take some time procrastinating about what it is, and then a few months thinking about how to do it. And then by that time, you're starting your foundation year 2, and everybody else is applying for specialty training at that time. So not to feel pressured about time. So that's one thing as well. Never feel pressured about time. Things will happen when they happen for you. That's just about it. You just got to keep working, do the grind.
Thank you, Mr. Ali. So I will take a question from the chat. Is there a specific yearly cycle like the US pathway to apply to each job category? Anyone of the panelists whoever wants to take it?
So if you're applying for training posts, then there's a yearly cycle. But if you're not applying for a training post, then you can apply anywhere. Jobs are available throughout the year. The way we recommend the recommended way is that you apply for a non-training post first, just to get used to the system, because it does get a bit too much sometimes. So you need to be able to cope with the pressures of being an SHO in the job. And once you're in the non-training position, you have connections, you have contacts, you have an understanding of how system works, you can give your exams, and then you can definitely apply for a training course. But like, I think for my journey was often comparing UK pathway to the US pathway for sure. And one of the biggest plus points for me was that UK doesn't make it very hard for you to get into the system. And once you're into the system, it is definitely easier to, spread out and see what you want to do, how you want to do it for sure.
And so for applying for these jobs, is there like a single algorithm like it is for US, or do you reach out to different hospitals individually?
There is a single portal. It's called the NHS jobs portal, I think. I don't know. So you just apply to all the job postings are there. You make your CV. You just need to tweak your CV for every job that you're applying just a little bit. But then it's fairly simple. It's very easy. There's no cost associated with it. It's for free. But I think one thing that helped me the most personally was reaching out to and making connections, because for every job post that people are applying for, it's not just you, it's people from all over the world, from all countries, Africa, India, everywhere, right? So I think one thing that really stands out for you is your somebody knowing you, somebody vetting for you that, okay, this is the person. So a very kind alumni did that for me, which is why I was able to get to that job. So I'm really grateful for them. But yeah, the vetting process really helps. Yeah, that's all we're gonna say.
Yeah, I would add that for like the non-training jobs, yeah, the NHS portal is the way to go. I think if you're applying for your first job in the UK, it's good to get something that's equivalent to the foundation program, like you're going through different specialties, just to get an idea of what it's like working in surgery and working in medicine, working in something else, A&E maybe. Because if you just do one specialty, you get very in a very narrow niche, and then you don't know anything outside of it, working in the NHS in a specific hospital. So it's good to get that experience of working in different things. The other thing is that for the training jobs, the portal is called oriel.nhs.uk. So that's something to go look at as well. Even if you're not applying for it, it's something to go look at. How it's structured, how the application portal works. It will show you all you can look at like the previous job vacancies that have been opened up previously and have a look at the details, especially in the specialty you're applying to. So then you'll get all the documents you need for that specialty in one place very quickly, rather than finding it on their different websites online. Yeah.
Thank you. So our second question is, how different is the pathway if you're directly applying for an FY1 post? So Mr. Ali, you can refer to this question.
So applying for an FY1 post, when I did it, I applied through Oriel basically because I was applying for a training program. In terms of that, if you are, as far as I know, and I don't think it's changed, you need to have a permit to work beforehand. So they're not going to give you a visa through this job. So don't expect to get a visa. Either the pathway is you are a British citizen, or you have a spouse who's a British citizen, and you're there on spouse visa is the other way. As far as I know, these are the only two ways to apply for a Foundation Year 1 program to get a work permit. In terms of the application, you do your same thing, PLAB 1, PLAB 2, GMC registration. You don't need to have completed the PLABs and GMC registration while applying, but there's a certain time limit. I think by, like, if your job starts in August, you have to have your GMC done by April or May, something like that. So all of those things have to be done beforehand. So that takes about a year, and so that takes about a year and a half really. And they look at your university transcripts. That gives you some points in terms of how you did in university. And then the other part of it is a situational judgment test, which is again ethical judgment kind of test, where you get different scenarios and you have to rank best answers. So you rank answers in terms of, and it's not always how you think it is. Although some of them are obvious, like don't hit the patient, but otherwise, some of them are a bit more nuanced, so it's not exactly simple, and even people here don't understand why it's there and how it works, but it's there, so you have to do it. And then you get, I think, in terms of, it kind of goes into the same kind of for all specialty training posts. When you apply, once you get your final, so there's no interview in the Foundation Year 1 application. Then once you get your rank and things, you put different regions, you rank regions in terms of where you want to go, and then within a region, once you get so you'll get allocated a region depending on how well you did and your rank. So the number 1 person gets their first choice, number 2 gets their first choice if it's different from the number 1's choice, things like that. So that's how it works basically, and goes down all the way. And then once you get allocated a region, you have to rank jobs within that region, and then you get allocated jobs in that way. But that's, if you don't have the work permit thing sorted, then there's no point worrying about it. So think about your other pathways. Don't worry about that. It honestly doesn't make a difference whether you do that or you do it as a non-training. So nobody's going to look at you differently or treat you differently in terms of your competencies.
Thank you, Mr. Ali. Moving on to our next objective, can someone shed light on the pathway of acquiring a clinical attachment in the UK as a medical student or as a graduate while you're going for PLAB 2?
So I think because I got one, so that would be either you just talk to someone I talked to Dr. If you know, in pediatric surgery, Dr. Suhail and Dr. Saqib, and they helped me in getting the electives. So usually there is, whatever you like, try to talk to the consultants there, and they usually know someone here. Otherwise, there are a lot of alumni who can help you. Unfortunately, I didn't know about much alumni here. That's why I had to go through that pathway. One thing about clinical attachment that I have learned through a hard way was that do not get a clinical attachment in a bigger hospital. Try to get it in a smaller hospital. That way, there are more chances of getting a job and being recommended there after you clear all your exams. On the other hand, if you do it in a bigger hospital, usually the consultants, even if they want you there, they still can't get you into the hospital because of all the things that's happening there. HR is very slow and all that stuff. So I think it's better if you get clinical attachment in a smaller area. And that's pretty much it.
One thing I want to point out that I understand that it's a bit difficult for because there's not a very strong hold of UK alumni group from AQ, so medical students and graduates don't really have access to it. But from within UK, we do have a WhatsApp group. We do have a couple of consultants, actually a lot of consultants who are very willing to give observerships. So if you guys have any need for an observership, please do reach out to any of us and we can refer from the the WhatsApp group that we have, and we can advertise what observership you want. Apart from that, we are trying to create a Facebook page where you guys can, post your queries like this, and we will have the UK alumni respond to your queries. But that's something that's still in process. Unfortunately, it gets really busy sometimes, so that's a bit on hold. Having said that, if any of the students want to be a part of helping us create the UK alumni connecting spaces, please do reach out. I think if you guys have time, please do, because it gets really busy here, so we're unable to give it as much time.
Thank you, Dr. Afsha and Dr. Amala. So moving on, we will now move on to discuss about the practicalities of getting settled in UK as an international medical graduate, including finding an accommodation, and to checking things out of a to-do list before you start your job.
Amala, do you want to talk about it? Because I think you're in the process of, actively, yeah.
Yeah, so getting accommodation, it's usually not that difficult because the hospital gives you an accommodation, which is almost one of the best place to live in. But after that, it's not that difficult. There's like a couple of websites that you go in and then you can, change or look for places that you like. So I think accommodation is not one of the biggest issue. Usually it's like, settling into the place and everything. But I'm not sure about other places, but this place, people, like, everyone is so friendly. They help you out. It doesn't matter who they are. Some of them are from Pakistan, others from India. Even my the closest friend right now, she's from India. So you find people usually, and even if sometimes we think, oh, we are coming from another country, so hospital maybe might be treated differently. Or for example, for me, I was not that confident because I had no clinical experience for past 2 years almost. So but still, like, everyone is so helpful. मुझे almost 2-3 weeks तक, I had only 1 week of shadowing, but they kept me on shadowing for like 3 weeks, the consultants themselves. So everyone here is so helpful. You will get adjusted within, I think, 2 or 3 weeks. It's just your own will. If you want to get adjusted, then I think it's a matter of weeks that you will get used to the system and everything. So yeah, I think that is not that difficult. Sometimes if you are like a foodie person, so it's a bit difficult to find good food, but you can always cook yourself.
I think I just want to add that for a little different perspective from Amala's, like, I have tried multiple times on the job. I've had multiple breakdowns because, it gets really challenging. It's also about the pressure that you put on yourself while you're doing the job. But yes, I was supported throughout, and I felt like even like my team is like, trauma and orthopedics is generally known to be a bit toxic, but my team is really nice in that sense that they're more understanding of, what it's like to be a new person in a new system. And it's literally like learning from scratch. Like, I was, by the time I graduate, I'm like, oh, I can do cannulas like this. But then when I started doing it, like, what is a cannula? What is this? What do you do with this? Like, what am I holding right now? So it seems like it's just you have to be prepared to learn from scratch, and also it's okay to have multiple breakdowns. But yeah, it's a journey, and it's I wouldn't change this journey for anything, because it's a very good learning experience for me personally. Yeah.
Right, so I would now want to say what a typical week looks like working as a junior doctor in the NHS. Mr. Ali, can you start us off with this?
Right. So your rota, your contract says you should be working 48 hours a week. No, 40 hours a week, and then at maximum in 7 days consecutively, you should do 72 hours a week. But there have been weeks I've done up to like 120, 130 hours. But that's working as a registrar, so that's a bit different. But the pressures are a bit different. In terms of as a junior, usually if you're working on a medical firm, your hours are like 9 to 4:30, 9 to 5 on a normal day. So basically everybody's on a rota pattern, so you're depending on your shift, your timings vary. If you're on like a day shift, yeah, so you'll either be 9 to 5 on medical, on surgical it'll either be 8 or 7:30 to like 5, 6 o'clock. And you'll come in and do your ward round in the morning, do your jobs that come out of the ward round. If you have time, head to theatre, do what you want, do some audit work, do some training work, study, depends. Usually it's always understaffed, so you always have more work than you have free time. So there's always work to do. If you are on call, your rota might be like a 12.5 hour shift. So, and you fortunately don't need to do 24-hour on calls as a SHO. So you'll either be doing a day 12 hours and then a night 12 hours. Or so that's a good thing. You don't need to do 24 hours or ward weeks where you spend the whole week on the ward. In some hospitals in Pakistan do that, unfortunately. So this, I mean, in terms of your working hours, it's more manageable. It's better in terms of being able to manage your time. It is still stressful. When you get home, you feel like you're shattered and you don't know what to do with yourself except for eat, watch the telly, or watch something. But yeah. That's more to do with the pressures on the NHS right now than the fact. I will say that because I've worked before COVID hit in the NHS, it was definitely much less stressful, much less pressure in terms of patient numbers, illness. People are just more ill now. There's a lot more patients, a lot more sick patients. There's less, it feels like there's less staff. So there's all different kinds of pressures going on at the same time, which is kind of affecting how you work nowadays, I think, and it's maybe not as enjoyable as it used to be. But I mean, you do have, I mean, if people understand what's going on, and it's not like people don't know that these are pressures. So I think there's a general understanding of it as well. At the same time, you do need to get the work done. So I think, and then most people do end up staying a bit late, half an hour late. You're not obliged to, so you don't need to. If you don't want to, you can pack your bags and go home exactly on the dot. Nobody will say anything. You hand over to the on-call team. If you're on a normal working day, there's nothing wrong with that. If you stay late, you can kind of report it, and you might get paid extra, maybe. If the hospital HR is good. So yeah, it varies, but I think compared to Pakistan, working in Pakistan, it's probably less grueling in terms of the hours, but then you have to cook your own meals and do your own housework as well. So just remember that.
Jabari, is it okay if I just go on a bit of a rant, because this is one of the topics I'm a bit passionate about. So I really like working in the UK, and I'm comparing it to my life in AKU. and what was expected of, being an AKU versus, and I also did my electives in the US. So I got like a brief picture of what it would be like. So the reason it's not easy to work in the UK, but I say that it's literally not easy to be a doctor anywhere. It's not easy to be a doctor in Pakistan. It's not easy to be a doctor in the US. It's not easy to be a doctor in the UK. So you kind of have to choose the battles that you will be fighting with this career. The reason why I really like working in the NHS is because I just took a 3-week break and I went on a vacation with my husband, and it was amazing. And it was mind blowing for me because I could afford it. And this is like the first time I could actually afford a vacation for myself. What I'm trying to say is that, I could afford it, which means that I'm getting fairly compensated for my efforts. And the place that I work in, it does have a cap of working hours. And if you work more, you're getting paid for it more. So this is the flexibility that I like in the NHS. I compared it to the US, where you cannot work less than 120 hours in a week. In the UK, you can work as a bare minimum hours, and then if you want to earn more and you're okay with letting go of your free time, you can also do that. So I think I really appreciate being paid more for the work that I'm doing more. The other thing I really like is that this job here, even though it's surgery and it is very tough, it hasn't taken over my life completely. I am able to do certain things, on the things that I'm passionate about, because that's the kind of mindset that they were at least telling me in AKU, is that if you want to do surgery, surgery needs to be your whole life. It needs to be everything. And yes, it is. It's not easy. It does take up a huge part of your life, but I knew that I don't want to be just a surgeon in my life. I want to do other things, and I feel like I do have time for other things. So I really appreciate that as well. The other point here about accommodation. So hospital accommodations are a great option. I think they're wonderful. My situation was a bit different because I moved here with my husband, and accommodations, at least my hospital accommodation, they didn't offer rooms for couples. So we had to look for something else around in town. Like Amala mentioned, there's Zoopla and there are other websites that you can look into. But the option that went for me really well was going on Airbnb and negotiating with the person, whoever has a good room to let or a good apartment to let. So it's fully furnished and it's like a guest house stay. So you're paying a monthly basis, which has bills included, which is council tax included, which is all these necessary things included. They also do your laundry for you. They do the linen and all of that every week. So it really is like a huge load off my mind as well, in terms of the energy that I need to put in like taking care of the rest of the things. So that's one of the options that I'd really recommend that you guys explore as well. But that does require some sort of trust with the person that you're negotiating with. Because Airbnb is you can do it through Airbnb as well, like a long stay, but we're doing a guest house stay, so it's not really so it requires trust. Zainab just asked a question about hospital accommodation. Yeah, they are just for anyone who's working in a hospital, they can apply for hospital accommodation.
And even during electives, when I had applied for my hospital accommodation, they gave me for about 2 weeks. And then I found like a paying guest kind of situation through the Muslim society, like Islamic center. So then I moved in there. But usually if they have place, so even for electives, they sometimes offer you a place. So you don't have to worry. Otherwise, there's Zoopla, there's Rightmove and spare rooms, I think. Yeah, so you can just go through all those stuff.
Right, thank you. Can you also point out how many days of paid leave does a junior doctor get?
Passionate about this as well, because I never imagined that we'd have this many days of paid leaves. So for my initial contract was for 6 months, and I was entitled to 14 days of paid leave. So what happens is that you get 0 days. After you're on call for 12 hours, you're entitled to a 0 day, which is just your resting day. So you can align up your 0 days and your annual leave in such a way that you get a longer block of time off, essentially. And then you get study leaves on top for any exams that you might be giving. There are leaves as well, in which you just need to inform your trust that, okay, you're sick this day, and there's no compensation for it or anything. They're very lenient about it as well. But it always pays off to have good attendance, obviously. So yeah, it's a very understanding system in that way, that and then there's maternity leave of I'm not sure how many months is it, but it's significant. I think it's 6 months if I'm
No, I think it depends on like your contract. Some contracts allow you for 6 to 8 months, and others are even if you have like training. So it even goes up to a year for mother, and for her, I think for father it's around 6 months or something like that. Yeah.
So that sounds amazing to me at least. And the other great option is that once you've actually come to the UK and you've realized that you're still working a lot and you're still not happy with the work-life balance, you can opt for a pathway which is less than full-time working pathway, in which your total working hours are decreased, but the total duration of your pathway has increased, of the training that you're taking has increased. I think one of the things that I've learned in the UK pathway is that the main virtue is patience. I think in AQ at least, there was a lot of pressure on me to just like quickly achieve my milestones, like do this, give step here, do this, apply for this, get done in 5 days, get consultancy in 7 years max, do it. But in UK, it's not like that. In UK, it's a bit more laid back, and you see a lot of people taking, locum jobs whenever it's comfortable for them, doing less than full-time work, and it's basically career is not your only life goal, and I really appreciate that about UK.
Yeah, I think that's a good summary. And so if you do up to 5 years, you get 20 days of annual leave, and then from the sixth year onwards, you get 35 days of annual leave. That's not including the days you get as study leave. So you get 30 days additional as study leave, which is impossible to use up completely. But you have that option as well, and you should always make sure that before you start a job that they're giving you a study budget as well. So otherwise, exams and courses, especially if you're applying for surgery, are very expensive. At least between like 700 to £1,000 each. So that takes a lot of funding as well. If you try and do things early, then sometimes you have to pay for it yourself. You have to pay for your conferences yourself as well. So don't, especially if you're here. So these are all things to consider in terms of your costs. And yeah, they have very good policy for maternity leave, paternity leave. You do have to make it up later on in terms of the end of your training, especially if you're in training. If you're not in training, then who cares? And you get, I think as a maternity leave, I think in the initial few months you get like full pay, and then slowly it starts getting deducted as a percentage. So it's paid maternity leave. So that's a good thing always.
Right. Thank you, panelists, for actually reminding us how important it is to being a well-balanced human being. And as Dr. Afshar said, that patients are the main virtue and their care should not be compromised. So, I mean, Dr. Afshar, you also talked about locums, and what are the prospects of salary and financially of working in the NHS?
So locums are basically just additional job openings when the locally employed doctors aren't able to fulfill the quota that they need to. So I can do additional shifts. I'm paid more. My per hour rate for locum is more than my normal working hour rate. So you can earn around, I think I did like 2 locum jobs and I earned around like 500 to 600 pounds or something like that. Really depends on what they're offering, when they're offering. You also get paid more for working more than 40 hours a week. So if you are just 40 hours, you have the basic pay. But if you're more than 40 hours in your normal rota, you get a band 1 pay. So I get paid £1,000 extra for working more. Apart from that, you also get paid more for working on unsociable hours, which are the night calls as well as the weekend calls. So that total ends up in pretty decent, amount of pay that you're getting after the tax has been deducted.
Dr. Amala, do you have anything to add to this?
So sorry, because I haven't even started my locums yet. So I don't have any like experience as of now. So I think, yeah, but she is right. This is what my understanding of locums is. So I think that's pretty much it.
Right. So do you think without the locums, a junior doctor can lead a comfortable lifestyle just on the pay?
Yes, I think, yeah, because if
Um,
you don't have a family, then I think it's pretty much okay.
Yeah, because I find myself doing locums to do vacations, and that's a luxury, right? That's not a basic necessity. So I have colleagues who are just doing locums like week on week, just so they can spend like a month in Dubai or something like that. So it's a luxury. Otherwise, not only can you do you live a very comfortable life with the pay that you're getting, you also can save up a little on top of that. So for someone like me who has AQ loans to pay back, so that's really helpful as well.
Yeah, done lots of loans just to basically bolster the salary rather than needing it to survive. You can live quite comfortably, not as much as 4 years ago, but yeah, it was a lot easier for me 4 years ago. But you need to kind of, I think I do locums as well because I'm doing courses, exams, things like that. It kind of goes above beyond my study budget anyway, in a way. So yeah, I think additionally on top of just courses and exams, probably as spending is around £3,000 a year, something like that, per year. So potentially, and you only get maximum like £1,000 from your study budget. So you do need to bolster that, or you need to be prepared to not save anything. But I think it's easier to save and just be mindful of how you're living, right? So don't go find the best apartments and penthouse apartments and things like that. Shop in sensible places and things. Yeah, make sensible decisions, and then you should be fine. Like in the first year, I was living in a shared house, which is a lot cheaper with my bills included. So then, with all the vacation time I got, I was able to go back to Pakistan maybe like 3 times. So that's great. So and save on top of that. So that's yeah. But now I can't do that because of inflation. But it's a different issue.
Right. So that actually brings us to our question in the chat. Can you comment on the current economic crisis in the UK and how it impacts the junior doctors working?
Yeah. So basically, the whole issue, I don't know how much you guys are following the whole issue of pay restoration and things like that. I'm not in very active in terms of those spheres and politically in that way, but keep up to date with what's happening basically. In terms of the inflation, it's impacting the whole globe, but the UK, especially because of Brexit, and mainly because of not gotten established trade agreements in place as yet. So it is squarely on the government to solve these things, but then again, they don't have money to solve it. So it's a bit of a tricky situation, but it should get better in the next 2-3 years. Definitely by the end of this year, it's expected inflation will come down, and then I think by next year, mid next year, probably be at the level that they're aiming for, which is like 2%. Right now, it's like 10%. So I mean, that's nothing compared to a situation in Pakistan, to be fair, but it's something that's impacting some people, mostly who don't have two salaries to live on. So if there's like a single salary household, where they have kids, things like that, it's more difficult. People in the UK, the local British people like to go on holidays. If they can't go on holidays, they get very annoyed. It's quite entertaining. But so like as like from Pakistan, you're like, yeah, what's a holiday? Yeah, you go to the beach like once every month or something, or you go to Murray or something like that, right? But for them, they need to go like to Spain or France or whatever. So the idea of holiday, they need to holiday like every few months, otherwise their system short circuits. It's quite entertaining.
Yeah, I really want to adopt this emotional coping mechanism as well.
Yeah,
Just
it's
hop
not a
on
good
a plane
coping
because it's
honestly, it's not a good coping mechanism. Avoid it if you can, but like go on holidays, definitely go on holidays, but like don't use it as a coping mechanism.
yeah. Right.
That's the only thing. So yeah, so it'll get easier. It won't be great. I think the way the world's economics works is prices do go up. Eventually, a salary matches it, but the prices don't really come down. Petrol prices will come down, but like food prices will come down, but they'll never be at the same level that they were at. That's just how economics works, really factually. So, I mean, things will get better. The main issue is more to do with the fact the government doesn't have money to fund training posts in terms of how your career progression works. That's where the economics gets more problematic for doctors. People think about obviously living costs. If you need it, you need it, and survivability is more important than training. If you have that issue in terms of your being a single income household, things like that. If you need a lot of people to support, but in terms of people like for myself personally, the more important issue is like training posts. The government doesn't have money to fund more training posts, although they need more doctors. When you look at like since 2011 or 2014 was when they last reported, and they decided this is how many doctors we should have for the next few years, or how many training posts we should have for the next few years. They were supposed to look at that in 2016, and then they haven't looked at it since. So you have the estimated numbers that should have been in 2014 without considering COVID, increases in elective backlogs, things like that. If you know about those issues going on in the UK, it's what everyone just harps about all the time, everywhere. Then the issue is the actual estimation of doctors has probably gone up way more than what they're estimating, but the training posts haven't increased. The number of hospitals haven't increased. Hospitals are breaking down physically. Roofs are falling down. I've heard about like a piece of roof falling on an ICU patient, like a small piece, not like a big chunk, so they weren't hurt. But it's sad. And there's like hospitals where I worked at have like metal beams supporting the whole roof throughout the hospital. So it's not ideal situation, and not all of those hospitals are being replaced with new buildings. So it is a big problem. I think the main issue is you come here to train, to progress. You can do it out of training positions as a non-training and go down that route, but it's not really the same in terms of your ending qualification. So it's a difficult situation in terms of that. But the most you can do is like pressure the MPs, but they can only do as much as they want. They're more fixated on short-term goals. Training doesn't really fall into short-term goals, unfortunately, and it's going to be challenging to see how it goes. But if pay restoration negotiations go well, I think it is important that they're talking about pay restoration, but I think the BMA also needs to talk about how training is going to be funded, how they're going to make new doctors, or take that away. How, like, if they said they're not going to restore pay, but they're making new training posts, I think that would be an excellent compromise. But I don't know what's going to happen. Training posts cost a lot more because they need to pay the doctor, they need to pay the consultants for training, they need to pay people to make the capacity for all the educational activities, things like that, wet labs, exercises, portfolio, they need to pay for. So all these costs go into it. So it's much easier for them to hire non-training doctors than bother to create more training posts. It's a bit sad reality, but and that's what makes it very competitive. There's a bottleneck. There's a big bottleneck in that way. So apologies for the long speech, but that's the reality of it. Maybe Afshan and Amala can add if more.
Yeah, that was pretty comprehensive. I think it's just following the global trends of economy, हर जगह economic crisis हो रहा है. And I think in terms of career, you need to make decisions that kind of like I come from Pakistan. I come from like a financially very like a poor position initially. So being here for me is like, wow, this is just like a walk in the park, despite all the the challenges that are going on. Because I'm comparing it to Pakistan, which is going through a really shitty time right now. So yeah, I mean, it's not, again, like I said, like, it's not easy to be a doctor anywhere, no matter where you are. like आपको रगड़ा मिलेगा and you will be in a difficult position for but then you get used to it, I guess. You just create skills to cope with it and all. So, yeah.
Dr. Mala, would you like to comment on this?
Nothing much, but like I think it's pretty much the bottleneck everywhere. Even if you see US, Pakistan, UK, so it's for surgery, it's difficult anyways. So we have to keep that thing in mind, and we have to act accordingly.
Yes, and I think as it was said earlier that you have to pick your battles regarding this. So we have a question in the chat. Any idea if the PLAB being replaced by the UK MLA will have any implications on the examination process?
I'm not sure. I think I heard somewhere it was going to start in 24, but it also have step 1, step 2, so it will be much more like similar to PLAB 1 and PLAB 2 maybe.
Yeah, that's pretty much it. It's going to be quite similar structure, content-wise, and how they do it. It's just the name is changed, and except the main thing is the final year medical students from the UK will also have to give it. So it's going to be for everyone, international and local graduates, to do, and it'll be the same kind of process in that way. So it might be beneficial for the international graduates in that way, unless they put something in to give preference to local graduates, which they tend not to, because they're very much about being merit-based.
I think one thing that is also I liked about these exams is that they're pass or fail rather than a particular grade that you're being graded on. So that makes it quite easy for you to take that stress off, at least, of having to score high, when you can just do your best and that will be good enough.
Right. Another question was that while we were applying for the ST post, I think there is a prerequisite that the applicant needs to have less than 18 months of experience in that surgical specialty, or they're overqualified to apply.
Yeah.
Sorry, do you want to do that?
No, actually, I do have a question with regards to that myself as well. So what I've understood is that 18 months of experience so it's like a point-based system. So for 18 months of experience, you get full points. But for any surgical experience above 18 months, you don't get full points. You get half points. Is it something like that? So you're not negatively marked, but it's
so it varies. So it depends on if you're applying for core surgical training or if you're applying for higher specialty training. If you're applying for core surgical training, having more than 18 months experience excludes you from applying for core surgical training. So that's specifically 18 months in any kind of surgical specialty. So that includes any work you do in Pakistan as an intern or a house officer or whatever. So all of that will be included if you declare it. If you don't declare it, that's a different issue. That's up to you whether you want to be honest or not. I suggest be honest. If you get caught out, you'll be booted out of multiple places in terms of your professional registration. So don't do that. So if you want to do core surgical training, that's pretty much what happened to me. I applied for core surgical training. The next year I was working as a house officer and I went over the limit. So I decided I'm not really going to bother with it because I was, in terms of my clinical work experience and things, I was as or more competent than the core surgical trainees. So I wasn't worried about that. I had a sensible consultant and supervisor who was more than happy to sign off things. I was doing everything the core surgical trainees were doing, so I was not in any bother about that. So I did something equivalent to that and got it signed off and done with that. I don't need to spend 2 more years doing core surgical training. That's one way to go about it, and that's what I was advised before I applied for core surgical training as well by some people. Some of the consultants here, the British consultants, they said, don't bother with core surgical training. It's just a whole faff and a process that's unnecessary. But it depends. Some places like where I'm working in Norwich, so they have really good core surgical training, really, really good. Where the core surgical training gets more training time than actual work to do. It's like they have no responsibilities. It's astonishing. All they do is training. So that's good in some places. For higher specialty training, if you look at certain specialties, orthopedics, general surgery, vascular surgery, I believe, as Afshan was saying, depending on how many years of experience you have in that specialty. So for orthopedics, if I was applying, I could be able to bring it up for you guys quickly if you give me 1 second. If I share the screen. So, and I show you this one. Hopefully you can see that. So, okay, that. Did somebody say yes or no?
It's loading for
No,
me, not yet.
It's loading.
Maybe I could open it up for you if you could tell me what you're. I think while we're waiting, Zainab asked a question. We've been told that the application process is very objective as it is point-based. Is the reference of this point system available from viewing? Yeah, it is. For core surgical training, you can write CST 2021 checklist, and it has a list of things and the number of points. So for example, if you're given your MRCS exam and passed it, that's like 3 points or something like that. So I'll write it down in the chat as well. So actually, let me just post a link.
Hello, can you guys hear me?
Yes.
Yes, okay. So I think that somehow, whenever I'm trying to use it, share the document, it's crashing. But basically, like if you have, in terms of higher specialty training, if you are in between 10 to 42 months of orthopedic experience, you get 8 points. If you have 4 to 9 months, you get 2 points. If you go above 42 months, it drops down to 4 points. But additional thing to be mindful of is the number of years you've worked. So if you've worked after your foundation training, basically, or your first 2 years of after medical school, if you worked 0 to 39 months after that, you get N1. So this is like a dividing number. So it divides your score by this number. And if you work 40 to 51 months, you get 2. So your score gets divided by 2. If you work 52 to 63 months, your score gets divided by 3. So it keeps increasing the more years you work as well. So there's all things to be mindful of. So Afshan's given that's a good website as well. And I did send the in the material as well, and the stuff I'd sent to these guys before. So it should all be in these 2 websites. And yeah.
Right. So this rule does apply to the run-through programs as well.
No, because in run-through programs, you're applying from, instead of doing core surgical training, you apply straight into a run-through program. So it doesn't apply to those. The rule in terms of having less than 18 months experience in surgery applies for run-through programs. So in Scotland, orthopedics training, they have 18 months limit. So I'm not able to apply for run-through training there. I can apply for joining into ST3. I can't join into ST1, which is the run-through. Yeah.
So the experience of the surgical clerkships also counts during this time frame, or is it just the postgraduate?
It's only postgraduate. Things you do as a medical student won't count towards this. In terms of the core surgical training application, it's everything will count. In terms of the higher specialty training application, it'll be after the first 2 years of your so anything you do that's so anything you do after the first 2 years will affect the dividing number, but otherwise it'll count in terms of your favor. So I mean, it's very difficult to explain without showing you. So go have a look at it, definitely.
All right. Thank you, Mr. Ali. So we're nearing the end of this discussion. This has been very comprehensive, and I think we have addressed most of the questions that the participants had asked. Moving towards the end, is there any other myths, anything else that our panelists would like to address?
I think there's one thing I'd like to talk about, and it's basically my own personal experience with choosing UK versus the US. And so again, this is very personal for me, so I'm not sure if anybody else can relate to it, but I feel like AQ is very US oriented and they really push you. And honestly, I think US markets itself as the ultimate solution to be the most competent doctor in the whole world. And yeah, I mean, there are definitely benefits to it because as a consultant, you get paid way more in the US than you do in the UK. But one thing that I've heard is that in the US, you earn for your kids. In the UK, you earn for yourself. So you're so busy that the money that you're earning, you're not even able to spend it on yourself. But having said that, US does have its benefits, and I'm not working there, so I don't exactly know how it works for them. So I was making it a competition between the US versus the UK when I was deciding for the UK pathway. And I think one thing I would like to recommend everyone is to not make it a competition, to make it as two alternative pathways that we are privileged enough in AKU to go through, right? Because not everyone has the same privilege that we have from AKU. We have alumni in both areas and they're very successful. UK has its own pros and cons, and US has its own pros and cons. And it's not a crime to not choose the US pathway because of its cons. It doesn't make you less competent, doesn't make you anything, different. So decide for yourself instead of getting stuck in that rat race that really pushes you, even though you don't want to be pushed in a certain direction.
Right. Thank you
Agreed.
so much, Dr. Afsha, for that comment. We all need to hear that.
Yeah.
Adding to that, I think once you are making a decision, like when you are weighing everything, you should make think about what you want from life. Is it like you want laid back life and you also want to pursue medicine and to enjoy it, then UK is the option. But on the other hand, if you want to you are so passionate that you want to become a consultant soon and you just want to practice and everything, then you have the option. So I think you should first weigh what you want yourself rather than what people say and whatever it is out there.
Just like
Yeah.
adding as a joke, like I like
Yeah.
cutting people open, and I also like going to Spain every 3 months. So that's a preference that I have.
Yeah, I think the only other thing to add is, yeah, if you're double-minded and you don't know where to do your electives, do them in the US. Don't do them in the UK if you're double-minded, because that is more impactful for your US applications. The UK, they really don't care where you do electives. If you do them in a surgical specialty, that'll help, and that's what will count. And if you have a letter saying you did it in a surgical specialty, even if you do it in Pakistan in a surgical specialty, that will help in the UK. So it doesn't have to be anywhere particular. You could go to somewhere in the Caribbean and do it, go to Africa and do it, whatever you want. Doesn't really matter for the UK. And yeah, that's pretty much it. Don't think that coming to the UK and trying to be a surgeon is any less hard work. It's as competitive, if not more sometimes. There are bottlenecks here as well. Don't think that, it's easier to get into surgery in the UK. It's definitely not. There's lots of people who don't get in. And that number is only increasing every year. So you have to work hard at here as well. You might have a better work-life balance in terms of your working hours, but honestly, to get into surgical training, I spend most of my non-working hours working on things to get into surgical training. So don't think that it's any less hard work. And I've been doing that for the last 2 years continuously. So it's no walk in the park either.
I agree with that. And especially I want to reemphasize the point Ali said that if you're unsure, do your electives in the US, because I think not only does it give you the exposure, it makes your US pathway easy, lest you choose to pursue it. It also helps you understand why you're making certain decisions for yourself. If financial issues are a problem, if you have financial issues for US electives, there's an AQ and a JRM scholarship that I was a recipient of as well, which really helped fund my trip to the US for electives. So if you go on AQ Giving Back and you write JRM scholarship, it's going to come up. It has a time limit when you can apply every year, and then they pick the most competent candidate for scholarship as well. So that's one thing that would help you guys.
Oh yeah. If you're on an electives topic, if you apply for UK electives, the parts Afsha mentioned exists, but the other part that's more formal is going through the universities, and for that you need to apply like a year or a year and a half in advance. So just be mindful of applying very early for those. You find those on the university websites, like if you go on Cambridge website or Oxford website or Queen Mary University, which is one I would recommend if you're interested in orthopedics at the Royal London Hospital. Excellent, excellent elective, and you get to operate all day if you want for 8 weeks.
Thank you so much to our panelists, Mr. Ali Pathan, Dr. Abshakhtar, and Dr. Amala Khan. This has been a very interesting discussion. Thank you for your time. And thank you to our participants for tuning in. I would at this point encourage our viewers to provide their feedback. The link is in the chat, and we would also be emailing this link to your email addresses. So thank you so much.
Thank you.
Thanks for inviting me.
So much for thank you for having
Allah
us.
Hafiz.
Thank you. Allah Hafiz.
Allah Hafiz.